What if you could improve, if not eliminate, symptoms of ADHD, anxiety, depression, and more without the use of medication? What if changes in symptoms could be seen in as little as 4 weeks, and that those changes could become permanent in as little as 12 weeks? Hi, I'm Dr. Jason Richards with the Better Brain Neurotherapy Center. Let me introduce you to Neurofeedback and answer questions such as, what is it? What does it help? How is it done? How is it different? Why haven't I heard of it before? Neurofeedback is a type of biofeedback that uses the monitoring of brainwaves to improve the way that the brain functions. Anybody's brain function can improve, from a child to the oldest adult. In children, we typically see neurofeedback used to treat symptoms of ADHD, anxiety, emotional regulation, and learning disorders. In adults, we typically see neurofeedback used to treat symptoms of depression, migraines, traumatic brain injury, and compulsions. All of these problems can be linked to abnormal brainwave patterns. Brain activity can easily be measured through an electroencephalogram, or EEG, and a map can then be created showing the brainwave patterns and how these patterns compared to a normal population. Once the abnormal patterns are identified and correlated to the symptoms, a treatment protocol can be set up and training begun. Training occurs subconsciously by the brain. It doesn't require any special activity or focused concentration. It simply involves watching a movie that dims when the brainwaves stray from the normal patterns or brightens with audible beeps when the waves approach optimal patterns. During a typical training session, which lasts about 20 to 30 minutes, hundreds of rewards are given. Over the duration of the treatment program, tens of thousands of rewards are given. The brain learns very quickly and subconsciously what it needs to do in order to get the reward. When the optimal brainwave patterns are repeated over and over again, a process called neuroplasticity occurs. This is where neuronal connections in the brain become stronger and stronger until these connections become permanent. Neurofeedback is different than brain games like Lumosity, Sudoku, and logic problems that focus on changing your skills and how you think. Neurofeedback focuses on changing how your brain functions, and a better functioning brain will have a huge impact on your life. Clinical use of neurofeedback was developed in the 1950s and 60s, and in the 1970s, clinical studies began to be published on the efficacy of neurofeedback in the treatment of ADHD. Since then, there have been hundreds of clinical studies published on the efficacy of neurofeedback for dozens of different disorders. Advances in technology and a greater understanding of the brain is now allowing neurofeedback to be available to the masses. Medical establishments, however, are a little slower to integrate approaches based on this new understanding, and old biases die hard. So, is neurofeedback right for you or your child? One way to find out is to talk to us here at a Better Brain Neurotherapy Center. Visit our website at abetterbrain.com for more information, as well as schedule your free consultation.